Maybe you were diagnosed with PCOS as a teenager, or you're under 19 right now, and you're wondering about how PCOS is diagnosed. So here's the tricky part. Diagnosing PCOS in adolescence is different. The same rules we use for adults don't apply. And so that can lead to a lot of confusion because even how you meet criterias for some of the inclusion criterias change. So if you're 19 and under, or you were diagnosed as a teen and you're older now, this video is still important for you because you need to make sure that you would have met the guidelines of the adolescent criterias. The other thing that makes PCOS so confusing is that it can look so different in two different people. And so maybe you were given a diagnosis and you look at your friend who has the same diagnosis and there's a lot of different symptoms. Or you think you have PCOS, but you've never really been diagnosed and you don't know what that looks like. So, hi, I'm Dr. Melanie Deschattelet. I'm a naturopathic doctor licensed in BC, and today I'm going to walk you through how PCOS is diagnosed in adolescence and what an at-risk diagnosis means and why reassessment later can be important in some cases. So, if you're 20 or older and want the full breakdown of the adult diagnostic rules, the 2 out of 3 criteria, got a separate video just for you. Check out my channel. This one here is for teenagers or people who have been diagnosed as a teenager. So to be clear, that's 19 and under. So in this special group of people in this age, we don't have a reliable way to assess what we call ovarian morphology, how the ovaries look a little bit different. Ultrasound and AMH are like off the table. So the 2 out of 3 rules do not apply. In a teenager, you need to have 2 out of 2. You need to have irregular cycles, and that's very specifically and differently defined in teenagers, and 2, androgenic symptoms and or blood work. Now, if you only have one of those 2, then it can be considered PCOS at risk, as long as the exclusion criteria have been done and other causes for those symptoms have been explored. So let's start with those 2 inclusion criteria for adolescents. So one is high androgens. Now, first, we just look for obvious symptoms. So that can be like very aggressive acne as a teenager, acne that doesn't respond that well to treatment, or acne that's very persistent, you're getting older and it's not really changing. That can look like a certain type of hair thinning. So not just generalized hair thinning, but if you were to look at the parting line in your hair, that parting line is getting like wider and wider, thinner and thinner. It can look like excess hair. So either excess hair on the face, excess hair going up towards the belly button or down the legs. Now, here's a big clinical pearl. In PCOS, the high androgen symptoms tends to be slow and progressive. If you have excess hair growth on your face and it's very sudden and very severe, sometimes that can be for other reasons, and that should be checked out, and you should really highlight that this is happening fast because a different workup should be done. So now let's talk about cycles, because even how we define irregular cycle is different in this population. So the first thing you're really going to know is when was your first menstrual period? How old were you? Because in the first year, irregular cycles are normal. If you are 1 to less than 3 years after your first cycle, cycles less than 21 or longer than 45 are considered irregular. And if you're 3 years and up since your first menstrual cycle, less than 21, greater than 35, are considered irregular. And anytime 1 year after your first menstrual cycle, you've had a cycle that's 90 days or greater, also considered irregular cycles. So it all depends on how many years since your first period. We have different cutoffs because it's normal that at first your body and the communication between your brain and ovaries are just kind of getting started. And so we have more leniency at first. So like I said, the big difference from adults is that we don't have an accurate way to assess for ovarian morphology. Now, you may have had an ultrasound for other reasons, but we an ultrasound for diagnostic purposes of PCOS, it's not reliable when you're 19 and under. So if you're hanging your coat on your diagnosis because of an ultrasound when you're 19 and under, you're going to have to reconsider and see if you meet the other two criterias. So what do we do then if some teens have some PCOS features, but like not enough for a clear diagnosis? For example, maybe has some of the irregular cycles, but not much of the androgenic symptoms, or the androgenic symptoms, but pretty regular cycles. We obviously assess for other reasons for those symptoms, but assuming all of that comes back normal, then we would consider it PCOS at risk. And so the recommendation is that when it's been at minimum 8 years after the first cycle, or like 20 years old and up, that we assess for the first time, because these diagnostic things become more accurate. We assess for the first time for ovarian morphology using like ultrasound, or when that's not available or there's personal preference not to have an internal ultrasound, we can consider AMH. So to summarize, I think this is, something that I spend a lot of time kind of talking about, because clarity is everything. If you don't get this first part right, it affects every other decision after. So if you're looking for a place, a community to get more PCOS IQ clarity, join me in the PCOS Shift Society. It's a worldwide space for education, accountability, and mindset, so you can raise your PCOS IQ and feel supported while navigating this journey. So check out the bio, and I can't wait to see you on the inside.